Great. Thanks so much, McCarran. And then from here, I'm going to kick it over to Emily Weber from the Kentucky Association of Healthcare Facilities and Kentucky Center for Assisted Living, who's been our partner on coordinating this event. Emily?
Yes, thank you for having us. My name is Emily Weber. I'm the Director of Communications for the Kentucky Association of Healthcare Facilities and Kentucky Center for Assisted Living. Apologize, our President Betsy is actually in Frankfurt right now advocating for personal care homes. So we're trying to do dual jobs here. We are also excited to see Health Enterprises Network on this call, as well as David Wolf. We really enjoy our partnerships with them and are looking forward to the relationships and what we can do in the future with them. At the association, we represent over 80% of Kentucky's skilled nursing facilities, assisted living communities, and personal care homes. Workforce recruitment is a huge topic for us. With our HR committee, we do a lot of different projects and try to help our members with their workforce recruitment and retainment. What we always like to say is we advocate, educate, and promote these caregivers, as well as dietary, laundry, those sort of things. It really is a true calling, and just very caring people. So it's a great atmosphere and a job to have, and we're looking forward to hearing this presentation. Thank you.
Great. Thanks so much, Emily. And David, you're up next. You've already got a couple shout outs from others on the call. David's going to be updating us on the Governor's Long-Term Care Workforce Development Task Force Subcommittee. They're doing some amazing work in trying to solve some of these, or mitigate rather, some of these workforce issues. We're all going to have to work together to solve it, but David's going to share some insights with you on the work that they've been doing.
Thanks very much. Hello, everybody. My name is Dr. David Wolf. I am the professor and chair of the Department of Health and Aging Services Leadership at Bellarmine University. And I am very honored to serve on the Governor's Long-Term Care, Post-Acute Care Task Force with Dr. Keith Knapp, who chairs that task force. In addition to our normal work on that task force, Dr. Knapp created, in consultation with the Attorney General, the Commissioner of Health, and the Governor, a subcommittee just looking at the issues related to staffing in long-term care, both in skilled nursing, assisted living, personal care, etc. So our goal is to try and match up as many displaced workers and potentially college and even high school students with open jobs in long-term care. For those of you that received McKnight's Long-Term Care News, there was an article that came out today quoting long-term care workforce has declined by nearly 5% since February. And while we are continuing to lose jobs, we're losing them at a less detrimental rate than what we were. According to this report, the jobs fell again in May, but we only lost 37,000 jobs in May versus 117,000 that were lost in April. So our task force is really charged with meeting with any individual or group that can help us form a statewide network to help displaced workers and college and possibly high school workers find jobs in long-term care. We did that, we used as a basis the CDC guidelines. You may have seen an article that is on the CDC website that was posted on April 30th called Strategies to Mitigate Healthcare Personnel Staffing Shortages. And we use that kind of as a basis to create a policy for long-term care providers in terms of what contingency capacity strategies they might have, crisis capacity strategies, and we issued a document on May 4th based on those CDC, I'm sorry, on May 13th, excuse me, that's when we issued it. And if anybody does not have that, I am happy to provide it. You can either reach out to me directly at dwolf@bellarmine.edu, or I'm sure if you send an email to Jesse or McCarran, somebody will get in touch with me, and I'm happy to provide that document to anybody that wants it. So that's some of the work we're doing right now. We've met with GLI, we met with Jesse and folks from Kentuckiana Works and looked at their job board, and our goal is to really scale it across the state. So geographically, we can match people that are looking for work with all of these long-term care facilities that are looking for both clinical and non-clinical positions. I know that was more than 2 minutes. Sorry, Jess. Thank you.
No, that's great. Thank you so much. It's important information. And we're going to get right into the content. I welcome you guys to ask questions along the way in the chat box. I'll be kind of monitoring, and if there's something that kind of immediately needs to be answered, I'll be sure to do that. And then at the end, we'll have some time for discussion, questions from everybody if you want to chime in or add other information that you know to contribute to this conversation. So give me just a second here. I'm going to share my screen with you. All right.
Jess, is this being recorded?
This is being recorded.
Thank you.
And we will send out the link to everybody on the call, and you're welcome to share that link with your networks. And I'm also, David, happy to provide that document. If you want to send it to me, I can just get it out to everybody on the call. Okay, so obviously we have a situation on our hands here. Workforce has always been a challenge in the healthcare industry. We had high demand before COVID-19. This pandemic took hold in our community and across the globe, and it has become an even more pressing crisis to fill these essential positions. On top of it, when you turn on the evening news and you see where some of the COVID hotspots are, you'll notice that many of them are in long-term care facilities. And so we're grappling with a few issues here in that marketing careers in long-term care, and not necessarily healthcare as a whole, but specifically in long-term care, it's kind of a challenge. You know, we think about our partners in the manufacturing industry, for example, and they kind of have to combat this notion that manufacturing is dirty and unpleasant and loud, and you're going to leave with a headache every day. When many manufacturing companies, you walk onto their floor and it really looks like a science and engineering lab. We sort of have a similar problem with long-term care. Not everybody wakes up and says, you know, I think I would love to go into the long-term care industry. So as a whole, really bringing the community together and creating a marketing strategy for very viable careers in this industry, careers where you get to interact with wonderful people, you get to make a difference in someone's life, you get to leave your job every day. I say this with my husband as a healthcare professional, knowing that you made a difference to someone. And so those are kind of the topics that we want to market to really showcase this as a viable career pathway. We also have the issue at our hands with very generous unemployment benefits at the moment with the $600 federal subsidy, that many workers are in a position where they might be better off staying out of the labor force than re-entering the labor force immediately. So for all of these reasons, and knowing how many industries, specifically hospitality and food and beverage, have been just detrimentally affected by COVID-19, we have 100,000 workers out of the labor force right now in the greater Louisville, Kentuckiana Works region. We needed to come up with an immediate strategy, not only to support those displaced workers, but to help fill essential positions, many of which are in long-term care and healthcare. So we worked with our partners at Kentuckiana Works, Louisville Metro Government, and Work One Southern Indiana to launch a displaced worker initiative. And that really started through a job board. That was kind of the initial approach. Let's create a one-stop shop so that displaced workers from these key industries that have been affected don't have to sift through 17,000 different postings on LinkedIn and Indeed, many of which are expired or no longer relevant. And they would have a place to go where we said, okay, everybody who is posting here, these opportunities have been vetted by our business service team. And we're constantly monitoring to ensure that those companies are still hiring, so that job seekers who search for openings on that platform don't end up at a dead end. We're marketing that job board specifically to individuals who have been laid off, not only through our partnerships with the different career service centers at both Kentuckiana Works and Work One, but also through community partners, nonprofit partners, partners like Family Scholar House, Goodwill, Louisville Urban League, in addition to our community college system. So JCTC and Ivy Tech, for example, have also sent out the information about this job board. So we're driving traffic to the site through that community outreach, but we're also reaching out to all employers who we know are laying off, either through submission of WARN notices and, quite frankly, just monitoring the headlines in Business First, or leads that we have through word of mouth, right? Even as far as sending out an email and getting a automated reply saying we're currently all furloughed, we're reaching out to HR executives and C-suite level executives at those companies to say, please, at the very least, share this job board with the folks who have been displaced at your company so that we can get them linked back into the labor force as quickly as possible. The hope was to also try to mitigate some of the stress on the unemployment system by re-engaging these folks as quickly as we possibly could. So a couple weeks in, we started to see our traffic die off. In late March, we kind of hit the 15,000 mark on the website, and that was after 3 weeks, 15,000 page views in 3 weeks. And then we started to see those numbers kind of taper down day by day. And so we thought, what else can we do here to make it even more appealing for a job seeker, make it even easier for someone who's out of work right now to find an opportunity? And so what we decided to do was take this a step further and create a job seeker connection program. That job seeker connection program, and I want to show you guys what this looks like, so give me just a second here, is very simple. Here's the job board, and on the job board, any employer who has an opportunity can post their position. Again, we reach out to them continuously to monitor that those are still active and available jobs. But then here we have this job seeker connection service, and so if you click learn more, someone who's looking for a job right now can go to this form. It's a very simple form. They enter key information, contact information, whether or not they're currently employed. And then here is kind of the sweet spot, the career areas of interest, their top skills, highest level of education, and probably most importantly here, based on the skills gap that we are already seeing and know is going to continue to increase, is what additional training and skills might they be interested in pursuing in their new positions. So what we know is that a lot of these openings, especially in some of the patient care roles, candidates may self-select out because they see that they need a certain skill, they need a certain certification that they might not already have. And so by incorporating this, we're able to give the employers who are connected to this program a spreadsheet of information. And let's see if I can pull one up here for you. So they're going to get the names, the emails of what we're classifying as hot job seeker leads. It's going to tell them all of that information you just saw as we sorted on the back end. This one's not sorted yet, so it looks a little bit messy. But they can see here, based on their areas of interest, like this one's for business services. A lot of these folks are interested in pursuing additional technical skills. We know that employers are going to have to be a little bit innovative and thinking outside of the box in kind of traditional candidates that they might have not considered in the past, maybe because they didn't have one of those certifications. At the same time, job seekers, we don't want them to self-select out and miss out on an opportunity where an employer would be providing that paid training, but they don't necessarily understand that. The other piece to this is by passing those leads, those spreadsheets that we're sorting by industry onto the companies who are participating in the program, we're creating an incentive for job seekers to get back in the labor force more quickly. that $600 subsidy is going to run out pretty soon. And in a matter of weeks to months, we're going to have a situation where 100,000 people are trying to re-enter the job force, the job market at the same time, competing for the same opportunities. Now that might seem great from an employer perspective, right? Creating a market that favors employers, but you want the right candidates in your positions. You want people who are eager to get back to work. You want people who are ready to learn new skills and who have kind of taken the initiative to really fill out this form and say, hey, I'm ready to jump in this role right now. I'm ready for a new career. I'm ready for a career in a new industry. This program is free for employers. All you have to do is shoot me an email after this call. If you would like to participate in this, as data comes in, it's usually weekly, that I sort the data, add new names to this list, and then I'm sharing that information with employers. And then from there, you can determine what to do. Maybe you have a recruitment team and you're very well staffed in the HR department, and they can make personal phone calls to say, hey, we've got this opportunity. We think you might be a fit. Let's talk through it. Or maybe it's just more strategic marketing of the positions, and you're simply sending out an email to these names saying, this is what we have to offer. If you're interested, here's where you apply. So it can be as in-depth or as simple as you'd like it to be. So I also wanted to talk to you all about the Academies of Louisville. I see a couple partners on here. David mentioned the importance of hiring new graduates, whether that's at the college and high school level, and this is incredibly important. This is more of a long-term talent development strategy. If you don't yet know about the Academies of Louisville, it's time that you learn about them. And as soon as schools reopen and we're able to bring businesses back into the schools, I encourage you to reach out to me, connect with me so that we can schedule a tour. Even if you have no intention of becoming a business partner, you need to see what's happening in these schools. We have 15 career academies, and within those academies, we've got pathways that directly correlate to positions that you all are trying to staff in the long-term care and healthcare industries, such as culinary pathways, patient care pathways, and administrative support pathways. The way the academies are set up, it's almost like, think about if you go to college and you're an undecided major. Your freshman year, you kind of dabble in general education classes, and then your sophomore year, you declare your major, and from sophomore year on, you take intensive deep dive coursework to complete the requirements for that major. It's very similar at the Academies of Louisville. Freshmen come in and they get to sample a variety of different career pathways that are offered at the school, everything from, as you see here, patient care, to graphic design, to cyber engineering, to welding. And then their sophomore year, they declare a pathway. From sophomore to senior year, they take a 4-course sequence, so 4 year-long courses. These are not electives. These are required in these 15 schools, wall-to-wall academy, and each of those pathways culminate in industry-recognized certifications. So we have students, I just listed a few here, and I focused in on the patient care roles. Our pathway students coming out of patient care, and there's a variety here, like the NOCTI Healthcare Core is for allied health pathways, Medicaid nurse state exam is for pre-nursing, and then patient care technician, I believe, covers a variety of different pathways, such as phlebotomy or radiology tech, I believe. But there's a variety of healthcare pathways. In fact, on our next slide here, if my slide will advance, you can see here that we have 10 different health science pathways at 13 different schools. There are 3,462 students this year in the health sciences pathway. The really exciting thing about this is most of our students, and the model that we're moving towards for secondary education and that transition into post-secondary or career, is not college and then figure it out once you get to college and graduate and then start to figure it out when you begin the job hunt. It's not that at all. We believe that college and career should be occurring simultaneously, and that's the model that we are full steam ahead pressing for. These students have work-based learning experience, they're coming in with credentials, and they're ready to take on patient care roles, a variety of different patient support roles, and potentially they're going to school full-time while they're working for you. And they're excited to build up their skill set in a patient care or a skilled nursing role as they pursue an RN or a BSN. And the same thing for some of the other pathways that I mentioned, such as culinary and administrative support. The last thing that I want to mention, or potentially second to last, I'm so many presentations these days, I can't remember how many slides I have. It's just the idea of forming strategic partnerships. Actually, let me back up just one second because I forgot to mention what an academy partnership entails, and that is a key component of this work. So we have several academy partners, and by several, upwards of 140. And what that looks like to partner with a school is it's a pretty minimal requirement, but it's up to the company to say, how deep do we really go here? The deeper the engagement, the stronger your talent pipeline will be out of that school. A minimum of 2 advisory meetings a year are required. That's where you come to the school, or potentially we'll be moving to virtual models for the foreseeable future here. But in those meetings, you meet with teachers, you meet with the academy coach, who's kind of the business liaison, you meet with students and parents in that pathway, and you really talk about how you can weave industry into the classroom content, into the curriculum, so that what students are learning is really brought to life by industry needs and industry standards. And then the other 2 requirements are a minimum of 2 activities a year. That could be a field trip, that could be a classroom speaker. We prefer that you try to go kind of a little bit above and beyond those kind of more surface level career exploratory engagements, and think through what it might look like to do a project-based learning experience with students, or hire a couple students for internships. At JCPS, students who have completed their necessary credits by their senior year can co-op, which means they can leave school somewhere between 10 and 11 o'clock in the morning and work for the rest of the day and earn credits through that work learning experience. So there are plenty of opportunities to take on kids. Hiring graduates out of this pathway, you do not have to be a partner to strategically work with our liaisons. I'm one of those liaisons, to get connected with academy coaches so that you can hire students who are eager to enter the workforce out of these pathways. Strategic partnerships, taking it beyond the academies of Louisville and really thinking about forming these deep and meaningful relationships with our community college systems, with their workforce solutions departments. Both JCTC and Ivy Tech are great partners, and let's say that you're hiring 30 people coming out of a career in hospitality that you need to skill up on the healthcare industry. Those 2 schools can work with you to help you create a crash course training program to get those folks the technical skills they need to be successful in healthcare. They also have a variety of associates programs. And then in addition to that, we have a significant number, upwards of 200 different organizations in our region that provide career service support or workplace training. And those different organizations have folks that are often overlooked talent pipelines that are ready and willing to get their foot in the door. I listed just a couple here: the Kentucky Health Career Center, which operates out of Kentuckiana Works, Louisville Urban League, and the Jewish Family and Career Services. They're all great partners. Just 3 examples I chose to highlight, and they each have workforce personnel that can connect with your HR teams to help you build that pipeline. They're engaging in hiring fairs. They want you there. They want your participation, and they know that they can connect you with eager talent. And then lastly, Kentuckiana Works and Work One. These are great partners of us at GLI and for the community. These are our local workforce boards, and they're responsible for the execution of career service programming, operating the career service centers, connecting folks who have been affected by COVID-19, who have applied for unemployment, helping them once that job search component is getting reinstated. So ensuring that you have contacts at those organizations as they start to work with folks who are navigating the opportunities that are out there is going to be of importance moving forward to really diversify your talent pipelines. So I gave you guys a lot of information, and I want to stop there and open it up for questions. And sorry, because I forgot to monitor the chat box, but slides and telling you all this information, it was a lot of variables for me. I'm not the best at technology, so apologize that. And were you all not able to see my screen the whole time?
Jesse, in the beginning, when you were going over the job board, we just saw your slide presentation. So I don't know if you maybe want to pull that screen back up again.
Sure.
Yeah.
Okay, give me just a second here. Sorry about that, guys. I am, the reason why is I had just chosen to share the slideshow and not my full screen. So I apologize for that. I'm one of the millennials that missed the boat on being good at technology. So this is what the job seeker form looks like. This is the form that they input their information. You guys can see it now? Yes. Perfect. Thank you, Kara. Here's where they indicate career areas of interest, skill set, education. Here's what it looks like on my back end before it's sorted. Let's see here. You can see there's some of the companies that are participating. So that's sort of what it looks like. Reloading here, we're getting new names coming through all the time. And then here's what the spreadsheet looks like that the company would receive. So they get all the names, contact information, they get the information about their skill sets, education, and then here's where it shows whether or not they're interested in pursuing additional training. And then that can be accessed through the Kentuckiana Works job board. We also have it linked through our Live in Lieu page. It's liveandlieu.com/job-seekers, and that takes you to the Airtable form as well. See, Karen, I'm reading your comment here. And Karen is one of the masterminds behind the partnerships, behind the pathways. She is amazing. Great.
You're sweet to say that, mastermind.
Let's see, Kara, is there a way an employer will receive a list of all openings we have posted? On the job board, you mean? Yes. Yes. So we can absolutely share with you. We can put them in different entries, but what most companies have decided to do is just create one link, and that usually links to their standard application page. Some companies that don't have that system, they also will choose to link to Indeed or LinkedIn, which isn't necessarily the best approach because it makes it difficult for us to track how many leads you're getting from us, but we can absolutely share with you the list of openings that you have on the site. Any other questions? The easiest way that an employer has it posted, absolutely. So let's see. So I think part of that depends on your own tracking. Papa John's, for example, created their own sort of link that was unique to our particular job board. If you want to track the candidates that you receive through this job board in that way, that's a great scenario. Otherwise, really just posting through to, so you can see here, let's see, this one has 3 different positions, but that's a staffing agency. Give me a second here to find one with multiple positions.
Thank you. It would just allow us with our different skilled nursing facilities across Commonwealth, Kentucky. I wasn't sure if that was something we should look to do and if that could help from a sourcing recruiting standpoint.
Yeah, so you can see here kind of how Baptist Health has theirs. They've got several different positions that they're looking to staff through this site. I'm not sure what's going to happen when we click apply now. I'm assuming it's going to take us to their, yeah, it's taking us to their APS. And you can see here now they have all their different openings listed. So I think to answer that question, it really just depends on what your system looks like in the back end. If you have, for example, really immediate needs that you want to prioritize, and obviously here Baptist has a significant number more positions than just these 4. If they had the capability to spotlight those 4 here, that would be my suggestion, because then it's taking out another layer of just research that the job seeker has to do. If someone was interested in patient care associate, for example, and now they have to sort through all of these different locations, if you had a way to link to the job board where you were already filtering for that position in the greater Louisville region, I think that would be the best case scenario.
Okay,
Does that
thank you.
answer your question?
Yes, it's just good feedback for us to have to see how we're doing it today to potentially know how we can improve.
Great, thank you. And yes, I'm going to type my email here in the chat box, and that's all you need to do is contact me. And I'll need to know what positions you are looking for, what are the highest priorities for you, and really that is just as simple as sending me the job descriptions. As far as the Academies of Louisville, if you're interested in partnership through that, we'll schedule a call, and on that call, we'll discuss a little more in depth about the different schools, what sort of the experience looks like for students and partners. We'll get into a little more detail, and then hopefully in the fall, we'll be able to schedule an opportunity for you to tour a school or two. Just like every company has its own culture and climate, every school is the same way. Usually there's one that feels like the best fit for you. And then from there, we move forward with connecting you to that academy coach, and they really become the liaison that kind of nurtures your relationship with that school. I'll also send out a follow-up email to everyone on the call with the slides, with the information, with the report that David discussed, and then that'll come from my email address. So any other questions that you all have directly, you'll have my email in your inbox. Any other questions or anything I missed, feel free to jump in, or any comments or thoughts. You know, we welcome feedback. So if there's something else that you all feel like we could be doing to better serve your industry, I'm all ears and happy to think through some of your insights and suggestions.
Hey, Jesse.
Hey, Kara.
Hey, it's Kara Soletto. As you know, I work with a lot of companies, especially senior care, to reduce turnover, and everyone's calling me to ask about recruiting and things. And I was curious, one of the biggest issues that we're having, of course, we always struggle with CNA turnover as an example, and the $600 unemployment thing is not helping in that particular instance. But up at the RN level and bigger picture, childcare is now becoming one of the biggest barriers to bringing people back into the workplace. So I was curious if GLI, or, you know, not that it can be solved or whatnot, but because these parents in particular don't know even what's going to happen in the fall with schools going back or not, or blended, e-learning, all this fun stuff. What are you hearing? What resources do you have? Where's the conversation right now around how employers can even help with the flexibility and the childcare issues? Because I've seen a lot of nurses who maybe got laid off at hospitals or whatnot, and they're telling me, like, I'm not going back to work until I even know what childcare options I have this fall. And that's killing my senior care clients. So if you could just speak to that, or anybody that was here on the panel kind of thing, I'd love to hear your thoughts. Thank you.
That is a great question. Lots of information to share on the childcare topic. We recently, last week or the week before, I can't remember, time seems to be really blending together in these long days at the kitchen counter on Zoom calls. We did host a call with the Division of Child Care out of the state to talk through some of these issues. I'm happy to link that webinar in the follow-up email that I'll send you all. But as a general sort of overview of what we're doing with that issue, we're staffing pretty regularly listening sessions with the childcare industry to talk through what their greatest concerns are. One of the biggest issues is that these industries operate at a very low margin to begin with. And with their capacity cut reopening, the state is projecting that 30 to 45% of facilities may not reopen at all. So with that being the case, and the facilities that are open having to reduce their slots, we're trying our best to advocate. Our public policy and advocacy team is working around the clock on this issue, among many other issues related to COVID-19, to advocate really at the state and federal level for greater funding, greater support for child care centers. And then in our call with DCC, they actually have a pilot program where they partner employers with family certified child care providers. So what that would look like, it's not necessarily taking your kid to their grandparents' house for the day. It's someone who's decided to operate a small child care facility in their home. This could be a great advantage for companies. Although the capacity is it's significantly lower, that also mitigates exposure risk, which is a huge asset right now. And it's a significant retention strategy for your workforce. So what it might look like is, let's just say a UPS. They're not a partner in this, but they're a good example. They've got people working on different floors in different segments of their warehouses, and they might decide, because they operate in a childcare desert, there aren't many childcare centers there, they might decide to partner with DCC to build out a family childcare network. And they could say, hey, these 10 people who all need childcare, who work in this particular section of the warehouse, are going to be partnered with one of these 3 families. The maximum capacity, I believe, it's either 10 or 12. There's some nuances in there, but you're not going to have any more than 12 kids in that home. And by creating a relationship between one particular department or one particular company and one family or a network of families, you're mitigating that risk. It could be as simple as that employer providing a subsidy for the childcare for that slot. And this is so much easier, less time consuming, less liability than what employers typically think about as very black and white in terms of the childcare issue is, I don't have the resources to build childcare on site. So there's nothing I can really do about this. This is a great strategy to offer a very, very significant benefit to your employees and ensure that they have slots held in probably what is the safest of environments during this pandemic as possible. So we're really working hard on advocating for child care centers, ensuring that they have the support to stay open. But I think that is probably the most viable opportunity that I've heard for employers to offer a benefit to keep people there, keep people coming back the next day. In terms of children who are a bit older, that's also some of the beauty of these family child care providers, is they don't have a breakdown by age groups and certain rooms for certain ages. So maybe you have a 5th grader and a toddler, they can both go to this family care provider. With public schools reopening, we do think that they're going to most likely have to adjust their model somewhat. We're not sure how that's going to look yet. It might look like some students coming in on certain days and some students coming in on other days. It might look like socially smaller capped class sizes, which is obviously going to be a strain on resources. I do think that it is a positive outlook that Metro Council understands that this is a workforce issue, and that if school's not in session next semester, not only are people not able to go back to work, but it exacerbates the equity gap in minority students that may not have access to internet at home or computers for NTI. So they're really pushing the governor's team to start thinking about what would a strategy look like so that students can return in the fall. As more information becomes available on that, don't hesitate to reach out. I'm happy to be a resource when I find out more.